Minister, it's very hard to know sometimes how to articulate something that you've been campaigning on for almost 7 years. I and others have been convinced of the necessity for Ireland to change its drug policy for a long time. And I've been working with others and other political parties and other movements, in lobby groups, in community groups, to try and get Ireland to change its view of the drug user. And within all that, Minister, there is space now for us to talk as a country about the treatment that we have handed down to those who have used drugs, who use drugs, who are in addiction services. There is a huge misunderstanding of the nature of drug use. We have attempted over the course of the history of this state to shame those who take drugs as much as we possibly can, to criminalise them in an attempt that they might stop. But that has been the most catastrophic failure, policy failure, on any level. It's an expensive disaster. It causes misery, pain, and death. The people who are most affected by it are the most vulnerable and powerless in Irish society. What you're actually doing when you criminalise somebody for their addiction or for their drug use, you're criminalising marginalisation. You're criminalising disconnection, because disproportionately the people who come into the criminal justice system as a result of being caught with something in their possession for their own personal use are from areas of disadvantage, are members of the travelling community, are migrants, are people with disabilities. And these are often people who are self-medicating trauma, self-medicating pain, trying to seek a connection. And what Irish society has done, what the Irish legislature has done, what this state has done, is to decide to criminalise that disconnection, to criminalise that marginalisation in an attempt to correct that individual. And it doesn't work. 70% of our cases in front of the courts, our drug cases, are for possession for personal use. It is a complete and utter waste of time, of money, of energy, and it doesn't work. So, Minister, we're waiting on the government. We're actually waiting on you, because myself and others across different parties in this Oireachtas have given you time, have given you space, have given you latitude to step up and be the advocate for the Citizens' Assembly on drugs. It would be easy for us in the opposition to dismiss the idea of a Citizens' Assembly on drugs to being a mere talking shop. But we decided, and I decided, and my party decided, that we had to come from a good place, a fair place, and to allow the Citizens' Assembly to be established, and within that to advocate for what we're trying to advocate, a radical overhaul of drug policy in Ireland. But, Minister, we are still waiting for you, and we're still waiting for the government to commit to establishing the Citizens' Assembly on drugs, where we can start a proper national conversation on a failed policy and to replace it with something new.
Thank you, and I want to thank you, Deputy Ríordáin, for raising this issue, and I welcome the opportunity to update the House regarding this very important topic. The programme of government includes the commitment to convene a number of citizens' assemblies, including one to consider matters relating to drug use. The specific timing of future citizen assemblies will shortly be finalised by government. Consideration is being given to the appropriate methodology for future citizens' assemblies, including one on drug use. And decisions will be guided by the experience of the Gender Equality Assembly, which completed earlier this year. An independent researcher was appointed by the Assembly to monitor and record, amongst other things, the perceived deliberative quality of the Assembly. And this report, published in July 2021, will assist in decisions on future Assembly's use of virtual meetings. By their very nature, citizens' assemblies require large gatherings to be truly effective. Therefore, there has been an unavoidable delay in the establishment of the next citizen assemblies due to public health restrictions arising from the COVID-19 pandemic. The Department of Health's approach to the Citizen Assembly on drugs use will be informed by the Government's health-led approach to people who use drugs, as outlined in the National Drug Strategy. An important component of the health-led approach is the Health Diversion Programme, which will offer compassion, not punishment, to people who use drugs. This approach will connect people with health services and provide a pathway to recovery, thereby avoiding a criminal conviction. As outlined in the programme of government, the programme will be reviewed after the first year of implementation to ensure that it is meeting all of its aims and to make any necessary changes. The review could usefully inform the deliberations of the Citizens' Assembly on drug use. A strategic priority for the implementation of the National Drug Strategy for 2021 to 2025 is to promote alternatives to coercive sanctions for drug-related offences. This will include the exchange of best practice with EU Member States as part of the EU Drug Strategy 2021 to 2025. I believe, as you do, that Citizens' Assembly could usefully consider the learnings from the Health Diversion Programme and other similar alternatives to coercive sanctions, and it could also inform the development of the next National Drug Strategy to replace the existing strategy in 2025. I have been in touch with the leaders, and I understand that the timing of the Citizens' Assembly will be determined by the three leaders of the three parties in government. And I hope that, as I said, that this will be announced in the coming weeks.